So like this stuff down here at the bottom, that's just a little bit of the glue, but the incision looks great. I recorded this video in the clinic a couple years ago, and even though the camera lost focus, I think you still get a lot of benefit from hearing the conversation between me and my patient and seeing some of the techniques we use that are non-threatening, non-painful, but designed to increase range of motion. In that position, with the elevation, how does that feel? Good? The swelling looks good. You relax there. I'm gonna let this come down. So when I pull like that, what do you feel?
Just a little tug in the back.
Yeah, and that's perfect. That's exactly what we want. So there's kind of two ways to get extension in the knee. One is I can come here and I can push. But if I push, your brain and your body is gonna tighten up and you're gonna be like, get away from me. Let that go right there. I prefer pulling. It's a gentle pull. I probably don't even give you like 20 pounds, 15 pounds. I do a little oscillation, so I kind of slide it or pendulum it back and forth. I can go a little bit up and down, but when I go up and down, what's happening is it's pulsing that into extension. It's hard to replicate this at home. About the best way you can do it is with like a strap or a band. You hook it to something, you wrap it around the ankle, and you slide your body back. We'll give that a shot a little bit later. You just do your best to relax. So right now you're kind of holding most of the weight of the leg, and I know it's tough to let it go loose. So when I take the pressure off and then I let it come back on, what does it feel like in this position?
Relief.
Yeah. Would you say it's painful when I'm gotcha here?
Yeah, a little painful. Just a tug.
Like a pulling kind of pain?
Yeah.
Okay. I can tell you every time I lift, right, I can feel the muscle relax a little bit. Every time I let it go down, I can feel it right there. I can feel the hamstring kick in to try and protect. And that's always the biggest challenge. And it's not something that you necessarily can control. You want to let it relax, but the nervous system and everything is going to try to protect that knee. There's a certain amount of discomfort, which is acceptable. But once it hits pain, or once it hits something that makes the joint and the nervous system feel threatened, you're not going to get any more range of motion after that. One way that I have found to kind of let it feel a little bit not quite threatened is to have contact on the bottom. When I touch here, it's telling the nervous system there's a floor, and it's giving it a little bit of support. So as I work you down into extension, I'm pressing in the back of the knee.
Yeah.
And it's much more relaxed in this position for you right now. Is it tender at all down here, around the shin?
A little more on the inside.
Yeah, it's a little swollen in there still. So when we're trying to stretch into extension, anything behind the knee is going to be good. Anything in front of the knee, because there are people who have pain in the front of the knee while we're going into extension, that's not helpful, and that has to be addressed differently. Have you been able to lay on your belly at all?